dental studio. Today I am going to discuss some important points or some important terms which we sometimes find difficult to understand in the chapter of development of occlusion. So let's begin. So first term is primate spaces. Now what are this? Primate space is also known as simian space or anthropoid spaces. So in the upper arch, this space is located mesial to canine. So this is here mesial to canine, and in lower arch it is located distal to canine here. So what is the importance of this space? We all know that the presence of spacing, that is mandatory in the deciduous dentition, because there is the size difference between the deciduous teeth and permanent teeth. So as the permanent teeth are larger, they require some space to erupt. So whenever there is the eruption of first permanent molar here, so this space closes. So we can say that this space helps in the eruption of permanent first molar. That is known as early mesial shift. So this we will also learn more about this in the further slides. Next is molar relationship. So these three molar relationships are present in the deciduous dentition. First is flush terminal plane. This means what we call end-on-end relation in the permanent dentition. So this is that the distal slopes of last molars in the deciduous dentition, they are at the same level. That is flush terminal plane. Now mesial step means, now this step, it's always present in the lower molar, not in the upper molar. It means that if we are talking about mesial step, the lower molar, this one, that moves more mesially than the upper molar. And same as the distal step means that this lower molar, this moves distally, that is backwards as compared to the upper molar. Now let's understand this relationship was present in the deciduous dentition. Now how this relationship will change into class 1, class 2 and class 3 in the permanent. Let's understand that. So this is there. So first of all, there was the distal step. Now what was distal step? That this lower molar, it is located backwards or distally as compared to this upper molar. So in the permanent dentition, it will always change to class 2. Now what is class 2? Class 2 means that maxilla is forward, and same is here. Maxillary molar is forward and mandible will be backward. So distal step will always change to class 2. Now coming on to flush terminal plane. Flush terminal plane was that the distal slopes of upper and lower molar are at the same level. Now this can either change to end on end or it can change to class 1. Now how this happens is, so whenever the permanent teeth erupt, there is the growth of mandible. We always know that mandible grows for the lifetime. Small growth, it happens in the whole of the life. So if there is the limited growth of mandible, it will change to end on end. If there is good growth of mandible, it will change to class 2. So normally flush terminal plane will come in class 1 relation. Now coming on to mesial step. Mesial step was that this lower molar, it is forwards as compared to upper molar. So we can see from here that either it will come in the class 1. Now it will come in the class 1 relation if the growth of mandible is normal, because if the mandible will grow more, it will change to this class 3 tendency. So all of this, that which class the teeth will come, it also depends on the growth of mandible. So distal step always in class 2. Flush terminal plane mostly it will come in class 1, and if the growth of mandible is limited, it will come in end on end. Mesial step, normal growth, it will come in class 1, and if the growth is very much high, then it will come in class 3. Next. Now transition to class 1 molar relation. That is, we already discussed that the size of permanent molar is larger or bigger as compared to deciduous. And so how that transition takes place, I have talked about this term, early shift, and there's one is late shift. Now let's one by one. Now what is early shift? Early shift was, we have discussed about primate spaces in the last few slides. Now that was present, we have discussed that it is present mesial to canine here in the upper teeth or upper canine and distal to the canine in the lower arch. So whenever there is the eruption of this is the permanent first molar. Due to the eruptive force, this permanent first molar has mesial gradient of force. So what it does is this pushes these both molars forwards and this results in the space closure. So this is known as early shift. So we can say that this primate space helps in the eruption of first permanent molar. Late shift. Now there is the term known as leeway space of Nance. First, let's discuss about it. Now, what is leeway space of Nance? It means that deciduous canine, first deciduous molar and second deciduous molar. And here is permanent canine, first premolar and second premolar. So what happens is, you can see here that there is the presence of space here between these two arrows. What is this? We can say that the mesiodistal dimension of these three teeth, these are always higher as compared to mesiodistal dimension of these. So it means that whenever the permanent teeth will come, there is some amount of space available here. So this space helps in the eruption of permanent canine, permanent premolar, both of the premolars. That is known as leeway space of Nance. So what was this? Late mesial shift. So this leeway space of Nance helps in the late mesial shift. There were two shifts, early shift. Now how the early shift takes place is with the help of primate spaces, that whenever there is the eruption of first permanent molar, due to mesial gradient of force, it pushes the first deciduous and second deciduous molar forwards and results in closure of space. And this leeway space of Nance, it helps in the late mesial shift. Late mesial means it happens late in the mixed deciduous dentition, that if due to any reasons the primate space was very less or it was absent, still the molars, or there can be a good transition of the permanent teeth with that of the deciduous teeth. Now this is an important term known as secondary spacing. Now what is primary spacing? Primary spacing means the normal spacing which is present in every deciduous tooth. That is known as primary spacing, which we all know that it should be present for the smooth transition of permanent teeth with that of the deciduous teeth. But for example, if a child due to any reasons has very less primary spacing or it's usually absent, so what then? Though the permanent teeth will not erupt or there will be crowding, still there is the phenomena known as secondary spacing. Now how it happens is, see in the diagram, whenever there is the eruption of lower lateral incisor, this, or the mandibular lateral incisor, what it does is, this pushes this one, deciduous canine, distally. It pushes the canine distally. And due to this distal pushing of the canine, it also pushes the upper canine distally, bucco-distally. So we can say, whenever there is the eruption of lower lateral incisor, first of all it pushes bucco-distally the lower canine, deciduous canine, and due to that distobuccal rotation, it pushes upper canine also. So overall, that results in increase in this. This is known as arch width. So upper arch width increases, and that helps in the smooth transition of the permanent teeth with that of the primary teeth. So this is known as secondary spacing. So we can say that still if the child do not has the primary spacing, still there can be smooth transition of the permanent teeth with that of the primary teeth. Now there are two terms which some really find it very confusing, that is incisor liability and incisor labiality. Now how to understand these terms is from this word labiality. Labiality means something is present labially towards labial side. So what incisor labiality is? So see in the diagram, these are deciduous, upper incisor, central, and this is the lower, and these are the permanent. So this is the deciduous and these are the permanent incisors. So you can see the inclination difference between that. So these both are somewhat straight, right? And this you can see in the permanent dentition, this upper incisor is coming more labially. So that is known as the incisor labiality. So what is here is primary teeth are upright but permanent teeth incline to the labial surface. So that decreases the interincisal angle. So interincisal angle means the angle, this one, angle between the upper and the lower incisors, that is known as interincisal angle. So due to the labial inclination of the permanent upper central incisor, that decreases the interincisal angle from 151 degrees, and in the deciduous it is 124 degrees. So this also increases the arch perimeter. So incisor labiality overall also helps in the smooth transition of the permanent teeth with that of the primary teeth. Now what is incisor liability? Incisor liability means that there is the difference between the amount of space needed for the accommodation of incisors and the amount of space available. That is due to the size difference between the deciduous teeth or incisors and the permanent teeth. What happens is, that is how much amount of space the permanent incisor require to erupt and how much is already available. That space difference is known as incisor liability. Means how much the permanent incisors are liable to erupt in that given space. So that is 7.6 mm in the maxillary arch and 6 mm in the mandibular arch. Why this happens? That is already because deciduous teeth are small in size and the permanent teeth are larger in size. So that's, and already the spacing is available. So that is, this amount of space will already be there for the eruption of the permanent incisors. So this was what is incisor labiality means. Labiality means labially, and liability means how much they are liable to erupt in that given space. So this was the difference between incisor labiality and incisor liability. So thank you. If you liked my video, please hit the like button and please subscribe to my channel. Thank you.